Imagine you are walking down the street, looking at all of the green trees and cars passing by you, the sun glistening on your skin. All of a sudden, a sharp, unbearable pain attacks your lower abdomen, a pain that leaves you hunched over, barely able to breathe. This is PCOS. So why should you care? PCOS is a metabolic syndrome that has different symptoms in the way that it affects the people who have it. Some may already have the disorder or know a family member that has been diagnosed. I will explain the ramification of the disease and how it affects someone who has it. I was diagnosed with PCOS in my sophomore year of high school. I know how some of the symptoms can affect a person every single day. I will begin by walking you through the definition of PCOS and discuss what it is. Then we will investigate the signs and symptoms of the syndrome and how it affects the female reproductive system. Finally, we will go over treatment options and how to best cope with the syndrome after diagnosis. First, I would like to inform you all on what PCOS is. PCOS, or polycystic ovarian syndrome, is a hormonal disorder that is common among women of reproductive age. According to the Mayo Clinic, women with PCOS may have infrequent or prolonged menstrual periods or excess male hormone levels. The ovaries may develop numerous small collections of fluid and fill the regular release eggs. On this slide, you can see the cysts that have developed on the ovaries. This is a classic sign of PCOS. Normally, the job of one hormone is to signal the release of another hormone. However, in PCOS, it does not happen correctly, and it causes a hormonal imbalance. Another characteristic of PCOS is obesity. It can exacerbate the symptoms of PCOS, such as further metabolic issues and reproductive abnormalities. PCOS can affect from in utero life until death, leading to several health risks that can impair quality of life if left untreated. Now for a little history of the syndrome. Interestingly, PCOS's signs and symptoms date back to the Egyptian papyri. A quote once said by Hippocrates notes that, "But these women whose menstruation is less than 3 days or is meager are robust, with a healthy complexion and masculine appearance. Yet they are not concerned about bearing children, nor do they become pregnant." Now we will discuss the symptoms you should know and how a healthy lifestyle may help lessen the symptoms of PCOS. It is important to be mindful that symptoms of PCOS can vary widely from woman to woman. Signs and symptoms of PCOS often develop around the time of the first menstrual period during puberty. Sometimes PCOS develops later, for example, in response to substantial weight gain. According to HealthCentral.com, signs and symptoms of PCOS do vary, but these are the most common: irregular periods, polycystic ovaries, increased facial and body hair, thinning hair on the scalp, acne, weight gain, pelvic pain, anxiety and/or depression, and infertility. On this slide, you can see all the symptoms that PCOS can cause. Now, we will go over the many treatment options that are available. According to PremierHealth.com, there is currently no cure for PCOS, and it does not go away on its own. To distinguish if these symptoms are from PCOS, lab imaging and testing needs to be done to determine if a patient has the disorder. Treatment options include, but are not limited to, birth control, anti-androgens, which normalize excessive hair growth and acne, fertility drugs for patients who are trying to conceive, and laparoscopic ovarian cauterization. There are also many support groups on social media. Girls with PCOS refer to themselves as sisters. They can be very helpful when trying to manage your PCOS. In summary, PCOS is a metabolic disorder that can affect and sometimes take control over someone's life. It involves symptoms that can restrict what someone does, and there is no real cure. However, that does not mean there is no hope. If you listened to my speech and thought this might describe you, then talk to your doctor. Look up more information and see if this applies to you. According to womenshealth.gov, 1 in 10 women have PCOS. You are not alone. So why did I take the time to talk about a symptom that most people don't know about? Well, because I have to cope and deal with PCOS every day. I, too, am a sister.